Good morning, and thank you for joining me today for my presentation. My presentation is called Bad Blood, Diabetes, and the Legacy of the Eugenics Movement. When Elizabeth Hughes was diagnosed with diabetes in 1918, she was predicted to die within 11 months. Instead, in a series of events that were only possible through her prominent parents and the intervention of top doctors and researchers, she died in 1981 at the age of 74. She had 3 children and 8 grandchildren, was a well-respected trustee of Oakland University, and co-founded the Supreme Court Historical Society. These achievements were made possible because she was one of the earliest people to receive insulin treatment, having had approximately 42,000 doses of insulin in her lifetime, a secret kept from her obituaries and even her friends. The stigma of diabetes in the light of the eugenics movement of Elizabeth Hughes's early life creates an interesting illustration of diabetes transformation as a medical diagnosis and a cultural perception over her lifetime. From the time that insulin was discovered and reproduced in 1921 until 1940, the eugenics movement was at its height. When convincing the general population to follow the tenets of eugenic practice, eugenicists used diabetes and other illnesses as a negative problem that eugenics could prevent, thus in their minds validating the movement as a whole. Despite their expressed concerns over diabetes and other illnesses in introducing eugenics, eugenicists in practice were not fixated on the reproduction of diabetics in the same way that they were concerned about people of color, the lower class, or the intellectually disabled. The reason why is twofold. First, in the early years, diabetics were not successfully having many children due to medical complications. Secondly, and more importantly, by the time that diabetics were successfully having children, diabetes was seen as a treatable medical problem and not a social problem like criminals, poor people, people with intellectual disabilities, and people of color. Despite the fact that diseases like diabetes were a fundamental justification behind the eugenics movement, the evidence shows that diabetes was largely ignored in comparison to intellectual disabilities, class, and race. The absence of diabetics from eugenic writings suggests that eugenicists used medical science as a pretext for their own bigoted ideas. In the decades following the eugenics movement, eugenic thought became unpopular. Sterilization laws that had been a key part of the earlier eugenics movement were repealed by the 1970s. However, as medical technology for diabetes and other diseases became more advanced, advocacy for eugenic thought increased once again. Neo-eugenicists adapted their thinking to embrace new genetic technologies such as artificial insemination practices and screening for disease during pregnancy. At the same time, they grappled with the coinciding medical knowledge and expenses that prolonged the life of dysgenic populations. Medical technology for conditions such as diabetes had been used specifically as a reason for a new eugenics movement. As medical technology increased, mainstream eugenic thought became medical genetics, which was more focused on medical conditions rather than scientific racism. Medical geneticists of this period flirted with the risk of falling into the same trap of old-school eugenics: discrimination against the physically and intellectually disabled in the name of a human ideal. Eugenics after the Second World War lost the previous baggage of scientific racism, but carried the same intrinsic risk as old eugenics of a social movement targeting race, class, and intellectual disability as social problems. Diabetes in this period was once again used as an example of what eugenics could fix as a medical problem and as an allegory for other disabilities, regardless of whether the genetic changes constituted a genuine improvement to humanity. As a simple definition, type 1 diabetes begins with an autoimmune reaction, usually in childhood, when the immune system destroys beta cells in the pancreas, thus ceasing the production of insulin. If a diabetic does not have access to insulin, they will die. The more common type 2 diabetes occurs primarily in adults over 40 and results from insensitivity to insulin rather than a lack of insulin. It's often treated successfully without insulin injections. For the purposes of this presentation, I will be primarily focusing on type 1 diabetes because it was more dramatically changed by the invention of insulin and more focused on by the eugenics movement. At the same time that insulin was invented, the eugenics movement was an active force in the United States. Eugenics is best defined as a social movement to shape the heredity of future population by encouraging the reproduction of the fit, white, able-bodied Christian population, and discouraging or preventing the reproduction of everyone else, especially people of color and the intellectually disabled. Diabetics with their chronic, expensive, and hereditary illness was, in theory, the exact sort of bad blood that eugenicists were trying to weed out. Eugenics history is missing from the history of diabetes to an astonishing extent. Chris Feudner's Bittersweet and Robert Tattersall's Diabetes, the Biography, are seminal histories of diabetes. Feudner discusses doctors that encouraged abortion for some irresponsible diabetic women. Tattersall likewise discusses the routine sterilization of diabetic mothers after they give birth by C-section, but he doesn't attribute this to eugenics. Tattersall and Feudner both discuss doctors approving marriage for their patients, a move that Tattersall calls paternalistic, but is more properly called eugenic. In A History of Diabetes in Pregnancy, Harold Coulter observes that as early as 1933, diabetic mothers were perceived as more frequently having children with congenital malformations, despite all the evidence being anecdotal. The absence of diabetes from the history of eugenics movement is even more striking. The historical research done by the American eugenics movement is focused on late Victorian concerns about racial hygiene and racial suicide, rather than on disability and chronic illness. The comprehensive 2013 Oxford Handbook on the History of Eugenics spends only one chapter on disabilities of any sort, and only one page on physical disabilities rather than intellectual disabilities. In a recent essay, Frank Decoder also noted that there was a major gap on physical disabilities in the eugenics literature, while maintaining the bulk of the eugenics movement was focused on Malthusian principles of population control for race, class, and immigration. Barry Miller argues that while eugenics was used to justify political ideas across the spectrum, the American Eugenics Society and other movements were always controlled by the wealthy native-born elite. My thesis supports Miller's and Decoder's arguments while aiming to close the gap of disability in the history of American eugenics. Mimicking the rise of the focus on bodily conditions by the eugenics movement, historians who study the recent rise in eugenics have also focused more on genetics and disability. Diane Paul found that after World War II, genetics and scientific racism were more strictly defined. This differentiation is seen in the literature, which focuses on prenatal testing, abortion, and genetic technologies. The rise of feminism has led many historians to discuss the role of autonomy in eugenic thought, both recently and in older eugenic literature. Paul argues that feminism and the rise of bodily autonomy as a value has led to a change in how eugenics is perceived and implemented today. While disability has had a more visible role in post-World War II thought, this paper will focus on how diabetes specifically was perceived in eugenic and medical genetic thought, which has not been covered by historians. When eugenicists were writing in the pre-insulin era, they were not yet concerned about diabetics' reproduction because diabetics weren't yet reproducing. Concerns about diabetes focused on the eradication of the disease alone, rather than on controlling diabetics' reproduction. In his seminal 1910 work, biologist Charles Davenport referred to diseases like diabetes as unfit and marriages between two unfit people as undesirable. But his calls to sterilize and segregate prisoners and imbeciles did not extend to diabetics. The historian Harold Coulter finds that female diabetics either died young or became infertile due to the treatments they received. Diabetic women who did become pregnant had between a 25 and 55% death rate in childbirth, with doctors in 1926 expressing doubt that women with type 1 diabetes ever survived pregnancy before insulin. As for the fetuses, miscarriages were very common in diabetics before and immediately after insulin, and stillbirths and early neonatal deaths seem to even increase after insulin due to more overall pregnancies. Due to the high death rate of both mother and child when diabetics even became pregnant, Diabetics weren't reproducing enough to even register as a problem to eugenicists at this time. The invention of insulin in 1921 was a turning point for diabetics and for medicine more generally. Insulin transformed diabetes from a death sentence to a chronic illness and created a new category of medical treatment, managerial medicine. During the 1920s, eugenicists began writing about the woes of too much medical treatment. Albert Wigham wrote in his 1924 book that, quote, "Curing this generation does not make the next generation any stronger," unquote. The International Congress on Eugenics, that met a few years later in 1934, continued this theme, criticizing the rise of managerial medicine. A doctor presenting at the conference predicted and condemned a future where the abnormal would become normal and the expenses of their treatment would fall on the public. Another conference presenter warned that if medical science does not address itself equally to sustaining and building up the physical factors that lead to race survival, as well as to individual palliation and relief, it promises to diminish rather than augment the racial prospect for survival. The invention of insulin sparked a new movement in medicine that pushed diabetes into the spotlight in eugenist thought. As the 1930s went on, the focus on diabetes diminished as diabetes became more normalized in society. Unfortunately, the same is not true for intellectual disabilities and race in this period. These were still seen as social problems, while newly developed treatments transformed diabetes into a strictly medical problem. The president of the American Eugenics Society, Ellsworth Huntington, said in 1935 that while minor defects would be eliminated in a perfect world, for now, people with such conditions should simply refrain from marrying each other. However, Huntington called for the sterilization of other groups. L. Burlingame's 1940 book puts it best. When talking about diabetes and a related problem, he said, "Since this condition presents a medical problem rather than a social problem, it is unlikely that society should wish to attempt their control through reproduction." Elsewhere in the book, he laments the cost of medicine to the government, but evidently, this was the biggest social problem he had with diabetics as a group. By contrast, Burlingame devoted entire chapters to race, immigration, and intellectual disabilities. Diabetics in the 1930s were becoming accepted by society, and thus by the eugenics movement. By 1945, diabetes was on its way to becoming more medically standardized. This can be clearly seen in the work of Priscilla White, a doctor and major innovator of treating pregnant diabetics. She developed a system of classification in 1949. The system rated diabetics from Class A, minor glucose intolerance, to Class F, insulin dependent with major complications. These categories helped better specialize hormonal treatments for diabetics. By 1953, doctors realized that the classifications also corresponded accurately with the rate of fetal death. As physicians better navigated pregnancy in diabetic women, the intensity and specificity of care also increased. Doctors began personally supervising pregnancy for the best outcome, and especially focused on the child as maternal health improved. During the same period of increased medicalization, doctors became aware of complications of diabetes for the first time. In this period, studies conducted on the first group of insulin-treated children, such as Elizabeth Hughes, found that a third of them had died by the late 1940s, half of which had died because of kidney damage. Surviving diabetics frequently went blind and often had nerve damage. Despite medical professionals being aware of these effects, the general public was not aware of any complications of the newly chronic disease until at least 1960. Like diabetes, eugenics itself was undergoing a transformation to become more medicalized. In the period from 1940 to 1960, eugenics was rapidly rebranding itself as medical genetics. Dr. Lawrence Snyder saw a role of eugenics in medical genetics. He argued that medical genetics was useful because it provided, quote, "the necessary information for setting up eugenic and euthenic programs in the protection of society." based on experimental data, not opinion, prejudice, or over-exaggerating the uncertainties," unquote. He hoped medical genetics could promote early diagnosis of diabetes and treatment with insulin in order to prevent the full development of the disease. Snyder wanted to treat diabetes as a disease and hoped to treat even more cases rather than earlier eugenicists who wanted to prevent diabetes and the costs of insulin. The period from 1960 to 1980 was a period of great change for eugenics. The historian Mark Haller wrote in 1963 that he still saw eugenics as active, but undergoing a more thoughtful shift. This change is reflected in eugenic writings at the time. The eugenicist Frederick Osborne's book, The Future of Human Heredity, was praised in the preface for leading the way in a new eugenics movement that was unburdened by the racism and classism of earlier years. Osborne documents a shift from eugenics into medical genetics in popular thought of medical clinics and the World Health Organization. While the eugenics movement was divorcing itself from social causes, it still condemned diabetics that had been increasingly classified as a medical problem over the last 30 years. The World Health Organization gave a statement in 1965 that diabetics should not marry each other and should not have children together. Likewise, in a groundbreaking conference on pregnancy and diabetes, doctors discussed that the medical standard for young diabetic women was to limit family size, even in the light of growing medical knowledge. Such advice was given in the light of struggles with high death rate in the infants, but it may have been influenced by eugenic or medical genetic thought. The preface for the same conference proclaimed infant malformations as a social and moral concern despite falling mortality rates. The conflation of malformations and disabilities with a social problem is indicative of the future path of eugenics. In a period when the social causes of eugenics were becoming increasingly unpopular, medical eugenics were thriving. The last 40 years has seen an unprecedented growth in genetic technology with serious implications for eugenics. As long as diabetes has been observed, people have seen a genetic link, and scientists now suggest there is a genetic predisposition activated by environmental triggers. The physician and historian Robert Tattersall suggests that we cannot change people's genes to prevent diabetes directly, but only their environment. With new genetic technology, genetic change is becoming more of a possibility, which raises serious questions about the roles of eugenics in medical technology. The health journalist Bonnie Roachman defined new eugenics as the relief of human suffering through the reduction of the incidence of disease, and further stipulates that new eugenics is uncoerced. Prenatal testing for diseases and disabilities such as diabetes allowed individuals, not leaders, to choose if they will birth a child. Nicholas Eggett disagrees. He argues that choosing genes for a child constrains future life choices, and if gene therapy is medicine, it should be restricted to the treatment of disease. This statement reflects the history of the eugenics movement becoming more medicalized. It begs the question of whether humans can be trusted with the responsibility of defining disease. Diane Paul argues that medical genetics is a form of eugenics that has already returned because it implies that some conditions make life unworthwhile. She further warns that social ideas are never fully separated from objective science, and that because of this, eugenics of any sort is in danger of falling into its own prejudices. The neo-eugenicist Richard Lynn is an example of this thought, with his focus on social problems like race and intelligence in his mind. He also argues that the reduction of deaths by infectious disease has created a dysgenic influence on intelligence and moral character. Medical genetics is certainly a descendant of eugenics, one that is attempting to alleviate the baggage of eugenics' social aims in the light of new medical advances. As Elizabeth Hughes reached adulthood in the era of the eugenics movement, she was able to participate in society by getting an education, getting married, and making valuable contributions to her community. In the 74 years of her life, diabetes had undergone massive changes as an illness. The reason why the perception of diabetes changed was that it was a medical problem and not a social problem. The eugenics movement, although based on scientific principles of heredity, used science to condemn people of color and people with intellectual disabilities as social problems. As eugenics became medical genetics, the history of the eugenics movement highlights the truth that science is often blinded by the assumptions and biases of its practitioners. And thank you for listening to my presentation today.